All right. Welcome to the show, Chris. How are you doing tonight, man?
I'm doing okay, man. How are you today?
It's been a good day. No
Yeah?
complaints here. Yeah.
No complaints, even with the little ruck thing you were talking about?
Yeah, that's getting better. I think I'm on the other side of that, and thank God. And
Ready
so
to
yeah,
rock
I'm
and
ready
roll?
to. I'm not ready to rock and roll yet, but I'm definitely getting there.
Craig evidently has a little bit of an injury in his neck, man. I didn't know that. I hope that gets better, dude.
Yeah,
That sounds
it is.
uncomfortable.
It's happened about 6 weeks ago. I think I pinched the nerve, and yeah, it was rough for a while, but now it's down to just kind of feels like now it kind of feels like maybe I slept on it wrong last night, kind of one of those kind of deals. So
See, watch how I do this here. That's kind of why exercise is overrated.
No,
Yeah.
it's not. I can't wait to get back at it.
It scares me,
As a
man.
matter of fact, I've probably had some. We remember when Sean talked about when guys get hurt and can't train. That's I've been dealing with that.
Oh wow, really?
Oh yeah, man.
You haven't been able to roll?
It's been 6 weeks since I've been able to do anything.
No kidding.
Yeah.
So you have not trained jiu-jitsu?
I haven't rolled jiu-jitsu. I haven't even done any yoga. I mean, it's the nature of the injury, man. It's you can't really do much when your neck is inflamed.
Well, you know what? Seriously, I mean, I made a joke. I do exercise, guys. Hiking is mostly my thing. I get my kayak out and get out in the woods and whatnot. But interestingly enough, maybe part of what we'll try to recall, and maybe write that down here. We'll go, what happens with layoffs and how does that impact stuff? Because when you can't do what you do to feel better with exercise, what happens there. But welcome, everybody, to another edition of Through a Therapist's Eyes, a podcast. He is Craig Graves. I am still Chris Kazdick, and we invite you to see the world through the lens of a real mental health and substance abuse therapist, trying to create emotional growth with you and for you, more with you. Feedback and discussion on throughatherapist'seyes.com. Craig, this is the human emotional experience. Would you be willing to figure this thing out together, sir?
Yes, indeed.
All right. So what is the title of our show today? We've got physical exercise and mental health. But boy, we've got an awesome dude that's going to join us. And he's been on our show before, Craig. Do you remember?
I do.
You do?
Yeah, I remember talking to Denny before.
Yes, Dr. Denny Morrison. He is, check this out, dude. You got to, I did not know we was talking to this dude, who we was talking to when we talked to him before, man. Look at the paper that's involved in this. I'm going to try to skip through who this guy is.
It's like 15 pages there.
Right?
Yeah.
Oh, my gosh. So this guy, Dr. Dennis P. Morrison, it all started, sir, in 1973. I'm not going to tell you that's when I was born, by the way.
Kids.
Yeah. 1973, pre-medicine preparation at Ball State University. So he is currently the owner of Morrison Consulting and the chief clinical officer / advisor with our good friends over there at Netsmart. You remember those words, right? Netsmart.
Absolutely,
Technologies.
man.
And we enjoyed
Hope
working
those
with
guys
them.
are listening.
Yeah, man. Hello, Chris. And the guys. Scanning down his resume super quick, in 69 to 74, he was a psychiatric technician. Back in the days of psychiatric technician in a hospital, right? You remember that job?
They were actually called orderlies back then. That tells you how long ago that was.
Orderlies.
Orderlies. Yes.
He has, in his consultantship, Craig, he's got 76 different companies that he's been able to list and being a consultant for.
Wow.
76 companies this guy has been willing and able to help out. He's got, I counted these up, man, 36 papers and publications and special presentations. That's pretty cool. And it goes onward with, what is this, miscellaneous boards. He's on 37. What is not currently on 37 boards. That would be crazy, right? I don't think you can.
No. Just on a couple or 2 or 3 provider organizations and international stuff.
And the serious bio points, man. Dennis, we were so glad that you're with us. He's the chief financial officer for Netsmart. Like I said, 2008 to 2012, served as CEO of Centerstone Research Institute. 95 to 2008. He was the CEO of the Center for Behavioral Health, CBH. And I've heard of those guys in my field around. Academically, he holds 2 master's degrees in psychology and exercise physiology. His doctorate is in counseling psychology, all of those from Ball State. Prolific author, frequent presenter, including a TED Talk, and co-inventor on a patent for behavioral health outcome software product. Serves on several academic, non-profit, and international boards. But check this out, Craig. Coming up, warming up. This guy's done a lot. He served in the United States Navy. Thank you for your service, sir. As an aerospace physiologist training, among others, members of TopGun.
Wow.
TopGun, brother.
Nice.
Yeah, TopGun. Now, I know the movie. I got to hear about TopGun.
That's cool.
In the physiology, hazards of flight, and land and water survival. Man, you have done a lot, sir. Welcome to the show.
Thank you. That's a nice way of saying you can't keep a job. There is some argument though about whether the members of TopGun can be trained either way. So that's a whole other discussion for some day.
Really?
Truth was, those guys were the among the most professional I've ever experienced, and it was really an honor to work with them. I was based out in Miramar in San Diego. Actually, I left there right before they started filming TopGun there on site. So,
really?
Yeah. So when we went to the movie, when the movie came out, we could actually identify. Oh yeah, that's the O Club over on one of the islands, and it was a great experience. But yeah, all this stuff all kind of ties together though when you think about it. It's all exercise and performance
training,
and so on. Yep.
Yeah, that is super neat. And I don't really know. I mean, the only thing I know about TopGun, to be honest with you, is just from the movie. I mean, is it actually, I'm curious. I mean, is it considered part of our special operations forces for the?
It's the Naval Weapons Training Center is a technical name for it. And it's actually, it's kind of the elite training operation so that kind of the best of the best going through naval aviation who are fighter pilots will go through the Naval Weapons Training Center. So the nickname is TopGun. So these guys are trained to kind of before they go out and into the fleet to learn how to be, excellent fighter pilots. And that's the whole point of it. But the thing that they're coming out with the sequel to Top Gun, by the way. I don't know if you knew that, but Tom Cruise is starring in it. And he's
Oh, the sequel of the movie.
Yeah. So, but what's interesting, and this is what the movie got wrong, was these guys, they're not these unprofessional, undisciplined, quote, mavericks, as Tom Cruise portrayed. They really are among the most professional, but, these guys got nerves of steel, and they have a lot in common with other disciplines who are in high performance occupations. So things like people who are police officers, surgeons, who have to make quick, rapid decisions with a lot riding on it. So that's one of those things that kind of is one of my interests, is working with people like that, particularly in sports and athletics as well. So you got athletes who have to maintain control of their psychological demeanor to be able to do well in their work. It's really similar to working with CEOs of large corporations, with police officers, with pilots, particularly fighter pilots and attack pilots. So all these things kind of hang together, both because it's living at the intersection of the physiology and the psychology.
Yeah, it's a razor's edge, I would imagine. When you start thinking about dealing with those high pressure situations and stuff, man. And I think that's where maybe part of our conversation comes in, with how to manage that, and, the anxieties that creates in the elevated states with the amygdala, like we know so well. We want to kind of do two things during this show. And shall I call you Dr. Morrison, or is Denny okay? What?
Denny.
Denny's okay? Okay. So first of all, before we forget, is there any way that they can, because you're a podcaster also, we left that off the list.
Yeah. With your friends at Netsmart, just a minor correction. You may not know it, but you said I was the chief financial officer for Netsmart, and I'm not. I'm the chief clinical advisor for Netsmart. I think the CFO of Netsmart would probably take offense at that.
Sorry about that. Chief clinical officer. Yeah, right.
Business if I was the CFO, so that's a whole other problem. But the Netsmart has a series of learning services that they offer, so you can get CEUs through webinars and trainings and so on. And one of the things that we did recently was stood up a series of podcasts similar to yours, a little bit shorter in duration, but they're designed to be part of the learning services offerings through Netsmart. And in doing that, we made them available to people who subscribe to the learning services suite of products, and clinicians can get half of a CEU for listening to a 30-minute podcast. So my job was to host those, not unlike you guys are doing now, and to do them with an eye towards kind of interesting clinical topics, again, not unlike what you guys do. So it's actually, I want to tell you, it's really fun to be on the other side of it.
Right.
And to not have to worry about the timing and all the other stuff that you guys have to mess with. All I got to do is answer your smart questions.
Right. I imagine it is a little bit of a switch for you. So glad. Let's kind of launch. Like I started to say, we want to kind of focus on two main things. Most of our time is going to be spent on exercise and your understanding of exercise and how it affects, mental health, specifically like, anxiety and depression and just our emotional state. And then we do want to spend a little bit of time towards the end on, specifically in kind of sports and sports psychology and how that affects us in our performance and whatnot. And we have kind of tailored around some specific questions that we'll kind of try to pepper in here. And I'm just going to throw one out because I think, this is a good way to start us out. And it was something that I was mostly interested in. It's because I really, my ears are going to be all learning today. So the audience knows, by the way. Craig, I hearken you as the expert between the two of us. That's for sure.
Well, I'm no expert. I mean, I do keep pretty active and physically fit, but as far as knowing how that affects mind,
you remember the definition,
stuff
right?
Stuff like that. I'm not the expert.
You know one more thing than me, and I'm willing to say that's got to be at least double digits, brother.
Well, I may know more than you about, but not on the level that Denny's gonna be able to enlighten us.
Super excited for that because I really think this is something that I really need to learn more about, and the public needs to learn about. For instance, I've been wanting to ask this question for a long time. Insofar as thinking about exercise, we know that it impacts mental health, right? Is cardio activity more or less, impactful in mental health as it relates to like weight training and different, maybe, what would you call it? Stagnant muscle movements, even like yoga or things like that. Like I would seem to believe that cardio really jumps your body and system up. How does that work?
There's been a lot more research on the aerobic effects of exercise on mental health, but the reality is that both are equally effective. So when you look at the literature on this, it's gotten more and more valuable. And I just want kind of a sidebar, to kind of serve as a bridge to this. Craig, you're an active exerciser, and you mentioned on our lead-in that you had hurt yourself, couldn't exercise. How did that affect you emotionally when you couldn't exercise?
It sucks. I mean, because you're used to being active, and I mean, I'm used to moving, and now I'm stationary, and you start thinking about losing losing your gains. I'm gonna have to start back from square one. In my case, I was worried that perhaps I had done something debilitating or something that was going to be, long term. Is this my new normal kind of, all those thoughts start flooding into my mind. And, you really have to get a handle on that or you're down in the rabbit hole, if you will.
So that I use that as a case in point because, that the flip side of that is somebody who does not exercise and they start in an exercise regimen. There's an old saying that people start exercise programs for the physical benefits, they stay with them for the emotional benefits. And think about it, that's been true for me. It's been true for people I know who work out a lot. That you say, I want to lose some weight, I want to get in shape, I want to get some guns, whatever. And what happens is you start missing it when you don't do it, and it starts having an effect on you. So So as a result of the research on this, it's been absolutely fascinating when you look at this. Bottom line is, first of all, kind of as a starting point, we know that in the United States, we don't get enough exercise. I mean, just generally, for whatever reason, we don't do it. Only about 22% of Americans meet the CDC guidelines for what is the kind of given as being kind of the basic amount of exercise you ought to have, which is about 150 minutes of moderate exercise or 75 minutes of vigorous exercise a week, including 2 strength workouts a week. Only 22% of Americans get that.
So you want to get both cardio and strength in order, because I heard you say earlier they're 50-50.
Forget about mental health for a moment. This is just what the Center for Disease Control says. Here's what is kind of the basic amount of exercise that everybody ought to get just for general health. The good news is that same amount, even a little bit less than that, actually it serves to improve depression, anxiety. There's more research on those 2 diagnostic issues than there are others, but it does have an effect on PTSD, substance use disorder, pretty much across the board. And so to your question, the results, there's more research on the aerobic benefits, but resistance training, strength, weights, etc., are showing similar results with both depression and anxiety. So, there are other reasons why you would want to do both, not just one or the other. But from a mental health perspective, either one of those will get you the benefits that you want. And here's what's really interesting. When you look at how good those results are, the general consensus out there is that the effect of exercise on depression and anxiety is equal to or better than antidepressants.
Right. Thought you were going there. I've heard that and I believe that. And honestly, I see that in my office.
Yeah. The data is pretty clear about that. And, but the problem is, in America, we don't think in terms of these kind of things. For example, this literature has been out there for a while. And that given the fact that we know that the data shows that exercise is as good at, let's use depression, is as good as antidepressants for mild to moderate depression, why would we not say that exercise is the first line of defense for treatment of depression, rather than, do exercise if you can, but both the American Psychiatric Association and the American College of Physicians both indicate that the first line of defense, or the first line of treatment for depression, is, guess what? Antidepressants combined with psychotherapy, specifically evidence-based protocols. No mention of exercise except as an adjunct. And that is not the case in other countries. The United Kingdom.
So you're saying in other countries, they actually have a first line choice. You come in, you say, hey man, I'm struggling. My mood's down. Yep. I'm really having stress and I'm aggravated, and I'm looking for you to help. And you're saying the first thing is going to come out of your mouth is, let's get an exercise regimen.
Exactly.
First line.
Yep.
Wow.
And in Australia, New Zealand and Australia, they look at inactivity as the cause of depression, where here we think of depression as something else, and so the exercise is like, that can help. That's from the United States perspective, that can help, but there's bigger issues afoot here. And when you look at the United Kingdom, New Zealand, and Australia, the thing they have in common is they are all single payer systems. So what we have, when you think about a single payer system, it is a de facto capitated contract for the entire country. So it is to their advantage to keep people healthy before they roll over and say, I got to go see a therapist. So they will do things to encourage the population to stay healthy and do things that does not cause a burden on the health system. United States, we are a transactional based system. You're in private practice, you're billing for transactions of services, a unit of psychotherapy or something. And that's the way, particularly in a fee-for-service environment, that's the way our system is set up. There's no place in there to say, okay, I just prescribed to you, go do exercise. How does a therapist get paid to have their client go do exercise? I mean, there's no clinical transaction there per se, even though we know it's clinically effective. So we've got that problem going, and we are the only industrialized country, actually, I think we're the only country that allows direct-to-consumer marketing of pharmaceuticals through television and radio. No other country does that. So you got this huge impact of the pharmaceutical industry on the healthcare system. Whereas if you live in the UK or New Zealand or Australia and you're under a single payer system, they're going to do everything they can to get you to do things before you have to actually impact the healthcare system.
And I think one of the things I want to point out, and you correct me if I'm wrong, because I'm listening to you say that, and Craig, I'm pretty sure do you have some thoughts, because you look.
I'm just thinking.
Yeah. Okay. Because, I don't think that's an intentional thing on the part of our medical staff or doctors or even therapists for that matter. Like I want to say that we're sort of, as trained clinicians and whatnot, doctors prescribing medications especially are sort of, I don't know how to say it, but like geared that way, almost like you say culturally, or the understanding of how we best do practice, best practice procedures. There's not a lot of intention about that. It's just the way it's set up, right? And
docs aren't trained to think about exercise as a clinical intervention. I mean, if they get any training at all about exercise, particularly from a postgraduate perspective for CEUs and so on, it's usually around sports medicine. It's about how can I help an athlete get better, or how can I help an athlete get back to work, get back to their game, not on here's how you use exercise. Because there's a lot of docs who, if you said, what is the minimum amount of exercise that the CDC recommends? There's a lot of docs that probably couldn't answer that. Because it's just not, as you said, it's just not part of the gestalt of the way healthcare practices in this country.
And gestalt, that's an interesting word, Craig. You remember hearing that word?
I do. I've heard that in a couple of different places. I'm not sure I know what it means.
It's Dr. Ted Spickler's talk about tacitly understanding something. A gestalt, a worldview, a perspective. It's like you're not thinking about it. It's just operational. And so the basic, I mean, this is fascinating, Dennis, because the operational aspect of helping people is not what we know works. Can we say best when it comes to exercise and whatnot, or what works?
I think what we're talking about, I mean, I think the thing I get concerned about, I don't know if it's a best issue. I think the issue is that we're not looking at a very cheap intervention for the treatment of really significant problems that has been shown to be effective.
So if not best, then certainly disregarded.
Yeah, it's just like you said, it's not, and I'm glad you mentioned this, Chris, because I think I don't want to make this sound like that it's a criticism of the system. It's just that it's observation that the system is built in a certain way so that it naturally doesn't look at some of these things. And I'm all for, I've worked in the American healthcare system, and I have lots of positive regard for it. But I also know that you don't know what you don't know. And if you have a system that kind of puts cultural blinders on, you won't see those things that are outside that. I can tell you, when I ran the mental health center here in Bloomington, Indiana, we got involved with a group called the International Initiative for Mental Health Leadership. And I was paired up with a CEO of a mental health center in England. And I really had to question whether what could a mental health center in Tees, England help us with in Bloomington, Indiana. But I thought, let's just try this and see. So I actually went there.
Okay.
And it was absolutely stunning, because we were all trying to solve the same problems: access and treatment efficacy and all those things that we all know are important. But what we don't realize is that we live with cultural blinders on, and you don't realize that until you go and talk to somebody outside your system. So we would be saying, what do you do about this problem? And they would say, well, we do A, B, and C. And I'm like stunned. It's like, well, what would you do? I always say, well, we do X, Y, and Z. And they go, oh my God. And all of a sudden, this cross-fertilization of ideas start happening that was not even intentional. We didn't expect that, but that was the benefit. And I think that's what we got here. We got this, U.S. healthcare system looks at things a certain way, and other healthcare systems look at them differently. And there's cross-fertilization here that can occur everybody can benefit from.
And I like the term cross-fertilization of tactics and treatment and first-line choices.
Right.
Because there isn't really a better or best that we can definitively scientifically say. Is that a true statement?
I think you can say things that are more effective than others.
Okay.
But I had a statistics prof in college who said life is a probability statement. There's very few black and whites in the world. Everything is kind of some shade of gray. So when you think about any treatment, including exercise, you can't say that if this person exercises, they will get this amount of depression relief. But you can say with high probability for a larger population of people, 100 people, 1,000 people, that n number of those will get that kind of relief. So it's hard to predict for any individual, but for a population, you can say that. So that's why when you say what's the best practice, well, there are some people that do best, absolutely best on antidepressants.
Okay.
Is that the best for everybody? No, the data is pretty clear that it's not. There are lots of different ways to approach this, and we're just not, to my mind, we're just not using one of the most effective tools in the way that we could.
I don't want to get off topic too much here, but you bring up an interesting question for me, Denny. Why don't countries look beyond themselves? I mean, why isn't there a group of professionals, medical professionals in the United States looking at these other countries and saying, what are they doing? What's working there that's not working here, and vice versa? How can we work together to have a better healthcare system globally? There seems to be a lot of globalization and a lot of that stuff going on, but it does seem like to me, not just from this conversation, that there's silos when it comes to healthcare.
Yeah, you think?
Yeah.
Both within and between countries. Well, I think first of all, I think they do. I think there are international bodies that look at clinical treatment and efficacy. The problem, I think, in part, is that every healthcare system is in part driven by its reimbursement methodology. So you've got the United States, which does not view healthcare as a right. It's more viewed as a privilege, and we can have a long debate about that conversation.
Let's not, because voting is coming up, man. We can't do that.
Right. But we do look at it a certain way, where other countries say, we believe all of our population should have healthcare. It may not be, they ought to have basic healthcare. That's kind of, so those are just, those are all those are philosophies, but they translate into reimbursement methodologies. So in a fee-for-service environment like the United States, although we're moving to other methodologies, that's changing the whole thing. And I think this issue that we're talking about today about exercise, in a different reimbursement methodology, the United States will have significant legs and opportunity for implementation.
So when you said a single payer system earlier, does that mean what is that? Tell me what that is. It's what?
There's one payer. There's not
Medicare for all.
Medicare for all. So in countries where there's Medicare for all, I think I heard I think you said that maybe prevention is part of that, because it is a healthcare. It's a payer for one payer, right?
Right. And prevention carries a bigger role in it. We don't have a healthcare system. We got a health treatment system.
Oh, absolutely. I believe that 100%. So if there were a single payer, let's say one of these Medicare for all plans got implemented in our country and we did away with private health insurance, do you think there would be a shift to a more wellness-based model at that point?
Well, actually, some of that's starting to happen already. We're right now, what we're seeing in the U.S. is a move towards value-based purchasing. I don't know if you've heard this term, but
I haven't.
It has to do with, instead, we don't pay for outcomes in the United States. We pay for trying. If you go into a hospital and you get a treatment, I don't care what the problem is, you get treated for it, and you get discharged and you relapse, you go back into the hospital gains by you failing. They get paid twice now for treating the same problem, because
right.
they did it the first time, or because you relapse for whatever reason. And that's a huge drain on the healthcare system. I mean, as you can imagine, we're not doing it right the first time, which is essentially a quality improvement issue. Well, as we go into value-based purchasing, if you think of value, the term value as defined as quality divided by cost, we are really good at measuring the cost of care in the United States, but it's hard to measure the quality of healthcare. But instead of paying for transactions, instead of paying for a hospitalization of someone, or paying for a session of psychotherapy, what it's moving towards is paying more for, we will pay for a certain outcome. We expect people to get better. And so if you go into a hospital, that hospital, instead of getting paid exactly the same amount if you relapse, they can get penalized if that person relapses. So think about what that does to the incentive system. Now the onus becomes part of that on the hospital is to prevent relapse. And maybe even if I take on a whole population, as a healthcare system, and I'm paid in that same way through what sometimes called capitation, that I get a flat amount of money to treat all these people, and whatever is left over after I pay my bills is my profit. There's no more do more, make more, which is what fee for service is. So now I have every incentive to keep people healthy rather than just treating them when they're sick.
I got you.
It reverses the whole paradigm. And so that's where I see exercise now coming in, and people were saying, geez, maybe if we can get people exercising more, we can keep them out of the hospital. So just as a case in point, I went on Medicare recently. Medicare has got all these incentives saying we've got golden sneakers programs. It's silver sneakers. It's so demeaning, but
a whole nother issue with mental health, right?
Yeah. But their point is like, we're going to pay for you to go to a gym. Well, why are they doing that? Not out of the goodness of their heart. They know because they can keep people exercising, they can help prevent some long-term chronic illnesses. So I think as we make this shift towards value-based care, we're going to see things like preventative care, which I would put exercise into that category as one of those things that's going to start getting a lot of traction. But you can't, it reverses the incentives.
Yeah, I see. That'd be huge. I think it would be big.
Okay, this is really going to be interesting to listen to the playback, and I want to gather those thoughts because we do have this as a hot national discussion, and I think I want to listen to the playback, but I think, Denny, you're kind of getting me personally to think differently a little bit about some of these things. So that's really cool. Here's what I want to do now, though. I want to ask you, I'm going to kind of combine two of the questions that I had together, and I want to really get us pointed back to, real specifics then too. Like, so all of that being said, what does exercise do to our neurotransmitters? What does it do for mental health? Let's get a little bit of our geeky science brain on and figure out what's really happening. Because I think if we understand that, if people really get that a little bit more, we're also more likely to do that. So I want to ask these two questions, take our break, and have you do a little plug at our mid-break, Craig, and then we'll come back with how this frames up the discussion here. So Denny, you can think about it this way while we do our little break thing. Do we have any scales? What's really happening neuromolecular level or whatever, dopamine, serotonin, stuff that we try to deal with SSRIs and medications? Do we know and understand what exercise is doing to that system in our brain, right? Like, we know you can do calorie counts. You burn off so many calories if you do 20 jumping jacks kind of thinking. And combined to that, what kind of consistency do we really need, and how does consistency play into that? So let's get your brain working on that. Craig, why don't we take a break because it is the holidays.
It is the holidays.
So here at the middle of our show, we have a website, I believe, through a what is a website?
Through a therapist's eyes.
Through TT.com, right?
Yeah.
Through a therapist's eyes.com. They can buy presents. They can buy gifts. They can buy things on this website, right? What do they got on there?
You can buy health supplements. We've partnered with the company, and they offer 126 and counting natural health supplements, anti-aging products, nutritional supplements, hormone creams, things of that nature. And if you go to our website, doitherapisteyes.com, and click on the whole family products link or the graphic there, and you make a purchase on that website, Chris and I will get a cut of that, and you help support the show. I also put a link on our Facebook page, Chris. I don't know if you saw that out there, but there's a post on our Facebook page, and they're having some great holiday sales, so now's a good time to check those guys out if you haven't already.
Shall we go back to the show?
Yeah, let's do it. I'm very interested in it.
So what do you got, Dr. Morrison?
Well, it's interesting that you should ask that first of all, about the neurobiological underpinnings of this. First of all, we don't really know what happens when you take an antidepressant. there's lots of speculation about why that works. It's, they think there's things happening in the synapses that are affecting serotonin or norepinephrine reuptake. We think we know that's correlated with it, but what's the causal agent? We don't know for sure. So
wait a minute, hold on. We don't know the causal agent of SSRIs.
Right. We don't know exactly what's going on in there.
Where the synaptic connections get blocked and we reuptake those into the neuron.
But that's a correlate. That's not, we can't say definitively that's what causes depression to get relieved. Because when you look back on it, we do not even know. I would challenge anybody, any neurologist to tell me what a thought is. Neurologically, what's going on when you think?
Okay.
We don't know, because we don't know that. We haven't been able to bridge that gap between that phenomenon that we experience in thinking and seeing and experiencing the world and what's going on with us neurologically. So when we look at taking antidepressants, for example, we know that these things are happening. We know that they are serotonin reuptake inhibitors, for example. We know that other things are happening, but there's also a body of work that says, well, those correlate with non-depression. They're targeted to do this, but we can't say definitively that that's why that happens. I mean, case in point, when that there are, for psychotropic drugs, really a lot of.
Greg, he's blowing my brain right here, man.
For psychotropic drugs, there are there are decision trees that a psychiatrist or psychopharmacologist would use to say, okay, if you have depression, the first drug we ought to give you is this. And if that doesn't work, then the next drug ought to be that. And the next one, if that doesn't work, we try this one.
Right.
Well, there's a reason why is it that Craig could take a drug and it would work great, and Chris could take it and it wouldn't do a damn thing?
Right.
Why is there so much variance in this in terms of, and part of it has to do.
And for the listening audience, there's also variance in dosage and
sure,
combinations of medications.
Individual differences. There are things called SNPs. They're called single nucleotide polymorphisms. And these are little pieces of genetic code that control everything you metabolize. Food,
yeah,
drink.
I've heard of this.
Yes. So, what we know is that SNPs control the metabolism of different drugs. There are about 13 of them that control the metabolism of psychotropic medications. So we know that if the great hope was there, maybe 5-8 years ago, was if we could do a genetic test on you, look at your SNP profile, we could then say, look, Chris is never going to respond to the first or second trials of the first or second drugs in that protocol. We got to go to the third. So and that's not borne out as good as we'd like, but a lot of people are using that. My point of this is there are genetic differences in terms of how we respond to these drugs, and your brain and your metabolism handles drugs differently than others. That's one of the things that makes it so hard to determine what is it that's causing antidepressants to do what they do, or really any psychotropic drug, not just antidepressants. Just that's what we're talking about now.
Okay, so dialing us in a little bit too, because we want to switch to sports here in a little bit, or that piece that we get back to. We know that we can cut calories, and we do calculations and whatnot. So how does that work with the systems that you're talking about in this calorie cut? Like you do 30 jumping jacks, and we know that's going to burn so many. Is that really even accurate?
Well, yeah, that's probably accurate. The question is that 30 calories going to translate into the same amount of weight loss for Chris as it does Craig? Which it oftentimes doesn't, because you metabolize differently. We used to think, when I went through my exercise physiology training, the fundamental assumption was you could calculate, if you could look at how many calories you took in and how many calories you expended in exercise, and the difference in that would be your weight loss or gain.
Right.
But what we know is that it doesn't seem to be true, because people metabolize energy differently. And there's all kinds of other conflicting factors. So, but the point is, but you can still get a good estimate. You can get a reasonably good estimate on that. To your original question about what's going on neurobiologically, that looks like one of the things that affects depression generally is neuronal atrophy. Like your neurons will actually get smaller under certain circumstances, one of those being depression, and that exercise causes a reversal of that. There's, you've heard this thing called neuroplasticity.
Yes.
Well, exercise stimulates the neuroplastic aspects, particularly in the hippocampus. So that this is one theory, and again, nobody knows for sure, but this seems to be one of the dominant theories about how this happens.
Okay.
So that as you stimulate this, all of a sudden your brain is starting to function back like it used to, and when you don't exercise, you get this decrease, and
just like a muscle.
Yeah, exactly. It's exactly like that. And that's what's really fascinating about this, because when I was in grad school 100 years ago, we were trained that the brain you're born with is the brain you die with. And whatever you do to it in the meantime, you're probably, the only thing you can do is kill brain cells, and that's it. Well, we know it's not true now. That's absolutely.
Yeah, we know that's absolutely false, but go ahead, Craig.
Well, I was going to say, based on what you're saying there, is it actual physical exercise, getting my heart rate up, have anything to do with it, or is it just movement in general? If I do yoga, an hour of yoga, is that the same thing as doing an hour run?
No, there does seem to be a relationship between the intensity of the exercise, but that said, doing something is better than doing nothing. It's just that on a continuum of like even this moderate exercise, like walking versus running, you're better off doing a little more intensive exercise, again, within the bounds of your physical ability. And the other thing that interestingly correlates with this, when you look at some of the studies where they've looked at this, they've actually had studies where they had people in a control group where they were doing nothing but maybe meditation or something. They had another group where they were getting vigorous exercise in a group, and another group that was trained on how to do that same vigorous exercise on their own at home. And it was the group that got the better results, but the people who exercised on their own still did better than the placebo group or the control group. What that tells us is there is a group effect. There's a social effect that is enhancing this stuff as well. And you think about it.
Hold on a minute. Did you just say how a group of people together exercise as compared to an individual exercising, and that there's a social impact somehow?
Sure. Yep, sure did. And when you think about what, like, one of my areas of interest when I was doing my master's, I wrote my thesis on compliance to exercise and what does it take to keep people exercising. And, that got me interested in compliance in general and adherence to clinical regimens. That's if you solve the problem of getting people to stick with their exercise or stick with their clinical regimens, whatever they are, taking their drugs as planned, doing their exercise, whatever, we will have solved the healthcare crisis, because that's the biggest variable that's killing us but because people don't do it right the first time. Well, one of the things that does correlate with sticking with exercise is to have a buddy, to commit to somebody. We are going to exercise 4 times this week. It is so much easier for me to not exercise when I'm on my own than if I've committed to Craig and say, look, Craig, 4 times this week, you and I are going to go to the gym, or we're going to go for a run or whatever. That there's that social connection that adds another layer of goodness to all this. And if you exercise in a group, you get some added benefits out of it.
That's interesting you say that, because CrossFit is such a big thing. These guys are exercising together. In jiu-jitsu, we talked about jiu-jitsu earlier, me not being able to roll. Mm-hmm. Same way. It's a very physical activity. I mean, at the end of that thing, you're spent. But those guys, man, they're my brothers and sisters. That's my crew, the jiu-jitsu guys. And, race, religion, whatever, doesn't matter when you're in there on the mats together. You just, you're getting after it. And at the end of the day, it's a big happy festival or whatever.
Yep.
And so that's interesting.
That the emotion of that group has an augmenting effect to the exercise, right?
Yeah, that's what it sounds like, huh?
Exactly.
That is powerfully cool.
Sure. But you think about it, we are social animals. Human beings are social animals, And when I was doing clinical work, I shortly after getting out of grad school, when I was still doing clinical work, which I don't do anymore, I was actually, Freud was a contemporary of mine.
Right.
One of my favorite types. I love doing group therapy. I liked it better than doing individual therapy, because you've got an additive clinical curative factor there that you don't get when on a dyadic relationship with a therapist. You get that, but you get this other layer of clinical efficacy and value that adds to that experience, because it's kind of somewhat intangible, but to me it was a whole different layer of clinical impact.
Let me think out of the box, but Craig, you go ahead.
No, go ahead.
You sure?
Yeah, I can ask my question in a minute.
Let me think out of the box here, Denny. I mean, I'm listening to you, and I'm thinking of what I understand about group dynamics and socialization, social culture, cultural issues, all of that stuff. And would it be interesting to study, or do we already know, like, when we're working out our muscles, like my pecs and my what's the femur muscles, whatever, your core, that is a muscle movement. And it's a little interesting to me to hear what it would do with the synapses of neuroprocessing and whatnot. Is it possible that when you're like with a group, that not only are you working your muscles, but you're also working other aspects of your literally your brain? Sure. The social aspect is tapping other things, not just your core, not just your buttocks, not just your biceps. There's other things that are actually also going on.
Sure. Yeah. I mean, you're kind of addressing in an indirect way the kind of the myth of the duality of human beings. That, it's that mind-body dichotomy that's false. That, we tend to think of, well, and that's one of the reasons, kind of to the point we mentioned earlier about the siloing in healthcare. Well, there's not another aspect of healthcare that's more siloed than behavioral healthcare. There's, a lot of people believe there's medical care and then there's mental health stuff, and nary the two shall meet. Well,
right.
That ain't the case. It's becoming more and more relevant when we look at integrated primary behavioral health care systems, where putting a mental health professional into a primary care practice, or a medical practitioner into a community mental health center, let's say, that you start treating the whole person and you get synergistic results. So what you're getting at, exercise is exercise, and it's physical and it's all that stuff, but we're always thinking, we're always perceiving and interpreting the world around us, and those social interactions are kind of hardwired into us to be important and valuable to us.
Do we know what that augmentation hardwiring is? Is that an intelligible question? Like, what's the connections there?
Well, I can tell you my thinking. This is not based on any research, but when you think about the foundations of cognitive behavioral therapy, that you are, Epictetus said, man is not bothered by the things that goes on around him. He's bothered by what he thinks about the things that go on around him. And so everything you do has to be interpreted. You're going, when we talk about CBT, what we're talking about is changing the way somebody interprets the world around them and reinterprets that so that it has a positive benefit to them, or at least mitigates the negative things they're telling themselves. Right. So that's the whole point of it. So when you go into an exercise environment, you're still doing that. You're still doing all that stuff while you're lifting weights or running or whatever, and you're doing self-efficacy assessments, as well as kind of how, the environment and whether or not it's supported or not. So all that stuff's going on simultaneously. It's not just, that's what, you're not just lifting weights. You're lifting weights, or you're doing jujitsu, or you're running, or you're, whatever your activity is. And if it's by yourself, and you got a lot of self-talk going on, I'm not sure I can do this, I'm getting tired, I'm not, all that stuff. Or if you're with a group, it's like, okay, I'm going to quit. Well, I better not, because then I'll look foolish because of these people around me. Or I don't want to look bad in front of them, or all that stuff goes on.
I hate trying to jog outside when cars are going by, Craig.
Yeah.
Craig, you get your questions together, and then we need to transition on more of time a little bit to the second part that we were going to spend about a quarter on with the sports and how that group, and maybe this is a little bit of the natural transition, Denny, with groups and whatnot, right?
Well, I had a couple questions, I guess. So earlier I asked you if high intensity cardio was better than yoga, for example. Is there a time threshold? Do I need to work out for 30 minutes, an hour 45 minutes before I get the benefit in my brain?
Yeah, there's only been a little bit of work on that I could find in terms of what is the dose effect. That's really what you're talking about, is how big of a dose do I need to get the clinical improvement effect.
Right.
It's like 30 minutes 3 times a week for moderate aerobic activity seems to do it. So if you follow the CDC guidelines for what we should all be doing, you're well within that. You're well within that range. But that's not been really dialed in as well as we'd like. But it does seem like 30 minutes 3 times a week will do it for you.
Okay. And I guess my thing to that was, there's a lot of stuff these days about standing versus sitting, and I've heard that, if you work out for an hour and then you're sitting for the rest of the day, and then you're sitting on the couch at night, you're probably not getting, you're still, hurting yourself or whatever by sitting so much. So you did say that yoga was better than nothing. So like is standing and moving more during the day a benefit to your mental health? Is there any research behind that?
Not that I've seen, but there certainly is for your physical health.
Okay.
What they're saying now is sitting is the new fat. Is the new smoking.
Right. Yeah, I have heard that.
Negative impact on your lives. So I don't know that there's anything about standing versus sitting for mental health. One of the things that, I'm dating myself here, but, we used to think about some of this stuff, that the curative factor in some of this stuff was kind of changing your locus of control, that instead of feeling like the world is impacting you, when you feel like you have an internal locus of control, you feel like you're impacting the world. And I think that's one of the things that kind of, from a layman's perspective, that's one of the things that exercise does for you. As you exercise, you are now controlling this one thing in the world that you have control over, and that's your body. And when you start doing that, that starts spinning up. Well, maybe I have more control over the world. Maybe I'm not getting whipsawed around by the world, which is what a lot of people feel like. But when you start exercising, you start, not necessarily physically strong, but just in control.
Exercise equals empowerment.
Exactly.
Wow. That's interesting.
Yeah.
What about spot drills, man? A couple of the guys that I listen to these days that are in the fitness industry talk about spot drills. So, for example, Ben Greenfield has a kettlebell in his office, and he'll do 10 swings on the hour every hour, or he has a pull-up bar, and when he walks under the pull-up bar, on his door frame, he'll knock out 10 pull-ups, and he'll do that every time he passes under. He might cumulatively do 30 minutes or an hour or even more during is there a benefit there too, or does it have to be 30 minutes at the same time?
Oh, I think it's 30 minutes at the same time, much like the aerobic benefit.
Got it.
But I think, but again, I don't know that I'm a little sure nobody's looked at spot drills from a mental health perspective, but it can't hurt you. And especially if he feels like that's his treatment or that's his exercise regimen, to not do it would probably have a negative benefit. You know what I mean? Like,
Yeah.
Oh, God, I screwed up. I should have done my workout. I didn't do my workout like I planned. But, all that stuff that happens. I mean, I didn't get my workout in today, because I was prepping for this thing. So
sorry.
I'll get you. I'll get it.
And I guess the final thing I thought of is, a lot of people start exercising to lose weight, and then they'll go a couple of weeks and maybe not see a drop on the scale or not a big drop and get frustrated and quit. But they're still getting the mental health benefits of exercise, even though they're not seeing the scales drop, right? I mean, there's still benefit in that. Continue to do it, right? They
could if they weren't linking their self-efficacy to their weight. Weight's a horrible indicator of fitness. There are people who are in phenomenal physical shape that are not svelte and lean and, many people, obviously the people and actually the flip side of that's true. My son, I have two sons who are in their 30s, and one of them introduced me, when he was in college, introduced me to a term I'd never heard before, referring to women. And he said, they're skinny fat. And I said, what? Skinny fat? He says, they are lean, but they don't have a bit of muscle tone. They're flabby, they're lean, they're skinny, but they have no muscle to their, you can tell they have no strength. And so he says they are skinny, but they're just, that just means they have a lean body type, but they're nothing but, nothing but flab.
Right. Okay.
All the women out in the audience are like, absolutely, man, tone up. We do tone up exercises, man.
And the other side, the other side of that though, is that, I mentioned this when we were getting started on this. My wife is an internationally ranked power lifter. Power lifters are big and strong. And so if you looked at her, she doesn't look like, a Ethiopian marathoner,
Yeah.
but she's in very good shape. So, we got to get out of this thing that the scale determines our health. The scale is like one of our worst enemies. So if you can get to your point, Greg, if you can get somebody who says, I want to lose weight, if you can get them to shift that and say, I want to get fit. And a consequence of that might be that I lose some weight. Well, that'd be great. But
right.
Don't scale as the indicator of success.
It's awesome that you say that, because I just talked about that with eating addictions just the other day in my office. I mean, the idea is not losing weight. I directly quoted to him, and instead it was really about the mentality of managing my addiction differently. And of course, exercise is a part of that. I need to focus us in towards the end here, because we actually need to taxi in. And I like the way our conversation has progressed and how it ended up, because I wasn't sure about this one, how we wanted to direct it, but we need to make sure we cover a little bit on the sports side of stuff.
Sure.
And I think the interesting factoid of the group dynamic in exercise is a powerful way to facilitate that. Is that kind of what sports psychology and exercise would be? I mean, is that to me seems like a big facet of that.
Well, it can be. I always think about these as two sides of the same coin. And, what we've been talking about is how exercise can improve mental health. That's been kind of the global topic. But the flip side of that is, how can psychology improve sports performance? So you've got people who are sports psychologists, for example, and a big chunk of their job is about arousal management. Everybody has kind of an optimal level of anxiety or stimulation where they perform the best. Any less than that, they don't do as well. Any more than that, they don't do as well. And so, and that curve, it's called the Yerkes-Dodson curve, is different for what your sport is. So if you're a lineman on a football team, you can take a lot more stimulation and still do your job, getting fired up and excited and anxious. But if you're a quarterback, where you have a lot of fine muscle control that you have to exhibit, you don't want to get jacked up. You got to get them to calm down. Same thing.
Let me jump in real quick to a point for our audience. We talked about that specifically at length with our talk with Miss Gwen Wild. Do you remember that, Craig? Yeah, that the listening audience really to listen to that what you just talked about. We did a whole show on that, and that was a fantastic reality in how. Hey, Gwen, by the way, she's still a friend of the show. She did an excellent job of really going into that in depth.
Great. So if she and I agree, she must have been pretty smart.
Yeah, you go.
But I always think about this, like the goal of a sports psychologist, for example, is to get your head out of the way to let your body do what it knows how to do. So, like if you're competing in jiu-jitsu, if you get overhyped, you're not going to, that muscle memory that you've been cultivating, Craig, and doing jiu-jitsu moves and throws, if you get overhyped, you're not going to have the finesse to do them the way you should do. But you're in a sport that is largely gross motor movement. You're not doing fine motor movement. But compare that to golf. When you're putting, you got to calm down. It's all about kind of finding that optimal level of stimulation that'll get you the best level of performance.
That's my golfing problem, Craig. Oh, you mean you can't get mad?
But that's true. I mean, you think about it, and this, kind of back to our previous conversation, this has a kind of a cognitive behavioral loop in it. It's what you're telling yourself.
Oh, it really does. I mean, I shoot my best round of golf when I am really in one of those steady states. A steady state, man, I'm driving the ball and I'm like, what is going on? But, you get out and you're all frazzled and edgy. Kid did something that torqued you before you left, and the round of golf is just like tore up.
Yep. Well, it's like you're getting ready to tee off. Somebody says, "Hey, have you ever noticed how your collar feels in the back of your neck?"
Oh,
What? Like,
that's great for money on the golf course.
exactly.
So, Denny, how do you find that state? How do you coach people through the emotions and the ups and downs, if you will?
Yeah. Well, there's, it's not psychotherapy because you're not talking about a clinical problem, but there are a lot of the same kind of activities that you do. So it's, relaxation training, focus, getting people to, I remember years ago, I thought this was elegant. I think it was Notre Dame that was playing USC in the Rose Bowl. This has been quite a while ago. And as they were, as Notre Dame was training for the Rose Bowl, they actually hired somebody to bring a white horse in and run it up and down the sidelines because USC had their white horse that they would be running up and down the sidelines. So to get the Notre Dame football team kind of used to this thing on the sidelines and not be distracted by it, that's one of those things where you do things to help focus the attention of the athlete on what it is they need to do. So you've got, things like kind of what are the mental skills that you need to enhance to do your job for your performance well. A lot of times it really is learning how to focus your attention and just learn how to just not be distracted by these other things as you're doing them. Sometimes it's things concrete like running a horse up and down the sidelines. Other times it's just learning mental activities to focus your attention on something and to the exclusion of other things. Sometimes it's about getting guys ready for competition because it's one thing to be performing well when you're practicing, but if you go to a jiu-jitsu competition, the anxiety level amps up a little bit, and now it's like, and it is for everybody. And most of the time, you learn how to handle that. But if you can't, that's where a sports psychologist can say, "Let me help you dial that in and give you skills." I mean, one of the best things people can do is get routines. Always do your prep the same way, and some people call that superstition, but it actually is getting kind of everything lined out the same way every time is kind of a good skill.
Yeah, I've heard that before, and you can see it if you watch some guys like Alex Rodriguez. I wasn't a huge fan of his, but after every pitch, he would step out of the batter's box. He would adjust both of his batting gloves in the same way each time. Mm-hmm. He would step back into the box the same way and take the same number of warm-up swings and prepare to swing every time, no matter what, strike, ball, whatever.
Yep. Also doing imagery. You can, because if you psychologically practice your event, especially if it's a repetitious event, you are actually getting a practice effect out of that. So you see it like with downhill skiers, that you'll see them before they go, they get their eyes closed and they're going, you can see them, they're going through the slalom, they're doing, okay, turn here, they're visualizing the same thing. The Blue Angels, the Naval Flight Demonstration Team does this. If you ever watch the Blue Angels sitting in their meeting room, they'll be sitting there, and you got these naval pilots that are the creme de la creme, sitting there with their eyes closed, and the leader is like talking them through their show that they're getting ready to do. Okay, we've got 10-degree bank. We're going to pull up. We're pull up. Afterburners now, and they're all doing the same imagery exactly together because they're flying within 2 feet of each other at 300 knots. So
these are powerful emotional realities, and I think that it's interesting to me the way they kind of combine and, as we said before, augment each other, because we know in the psychology world, right, in the therapy office, the self-fulfilling prophecy, what you envision, what you imagine, you've got to think it before you do it. I mean, these are all the things we talk about, right?
Yeah. What's that? There's that old saying. It's like, whether you believe you can or you can't, you'll be right.
Yeah. Henry Ford said that, right? Yeah.
Hey, one of the favorite things that was really foundational, y'all are going to laugh at me, but the Little Train That Could, man, that was my favorite child book. I think I can. I think I can. I think I can. I think I can. And I was like, you know what? Then you can. Yeah. I mean, that's what we're talking about.
Yeah.
Yeah, a lot of this, I'm going through a certification program, Denny. It's a coaching certification program developed by a Navy SEAL. His name's Mark Devine. And this sounds a lot like the big four of mental toughness. And what what that is breath. There's the big four. So it's breath control, calming yourself with your breath, and positivity, positive self-talk, and then imagery, visualization, and then setting those micro goals, just all I've got to do right now is this little thing and then that little thing. And it just keeps going instead of looking at the big picture and overwhelming yourself. It's just those little things. Yeah, but the visualization piece is interesting. I think, Tiger Woods, I won't say famous for that, but I think he used that as part of his training. When he was a kid, he used to visualize being on the green at the Masters on the 18th hole with the lead, and of course that came true a couple times. But I think there's a lot to that.
Okay, altitude is decreasing. We are going to land here in a minute. It's funny, Denny. Craig just said he's going through this training now. I'm not joking, and I think it's funny when I'll chide him. I'll say, man, he thinks he's just started this and he's finishing this training. Brother, he's been training through doing this show. Like he's already been trained and he doesn't know it, I don't think. He's amazing, Craig. Your brain has picked up so much. What he says on this show is demonstrates that, I would argue. So first of all, before I forget, how would they listening audience find your books, materials? How can we point them? And Craig, you'll connect with him and make sure we have that on our sites and whatever, but where can they get more of Mr. Dr. Denny Morrison?
Well, I don't have any books or anything published. I'd love to be able to say go to Amazon, but I don't have anything like that. But the stuff that I've written, I'm happy to have people reach out to me through you guys if you want, or they can reach out to me directly. My email address is dmorrisonphd@gmail.com. And the stuff that we're doing for Netsmart, you just go to Netsmart's website, ntst.com, and you can find stuff on learning services there, and that'll lead you to the podcast and how you can get in the loop on those. They've been a lot of fun, and we've been doing some interesting things just like you guys are. This has been a lot of fun for me tonight, by the way. I really appreciate you guys taking the time.
Thank you for coming. We appreciate you. Appreciate you spending some time with us, and I'll check that podcast out for sure. I'm a podcast listener, man.
Great.
Well, he's turned me into a podcast listener. How do we summarize this stuff up, man? I mean, we've got some things about groups that have just blown my brain away. In doing exercise with people in our lives, we talk about a little bit of the neurochemistry and stuff that's going on there that is striking. As much as we think we know, we don't know squat because we got more questions about what we know, which is the way science is, right? How do we summarize this all?
Well, to me, it's start doing something, anything. It doesn't, a lot of people get this perfection paralysis thing when they want to start a new skill like exercise, and just start walking, start doing anything. If you've been sedentary, because it's so easy to say, oh my God, I'm going to have to learn how to go out and run marathons. No, you don't have to do that at all. Just find an exercise, an activity that you like. Badminton or walking or swimming or just whatever you like doing is the thing that you'll keep doing.
Let me tell you how easy that is. Just in my office today, because I do fun activities with kids, I had, Craig, a hacky sack ball going up and down all over my room. And I ain't not even kidding you. We did that for about 20, 25 minutes with this kid, which, by the way, after he did that for a little while, speaking of what you were talking about with that curve, he was dialed in for the last section of that therapy session, baby. But anyway, I'll tell you what, that 20 minutes of a hacky sack ball got me going.
Oh, that would get me going as well.
Yeah. It doesn't take much is the point, right?
No, it doesn't. And especially when you're going from nothing to something, just set your goals realistically and say, look, all I got to do is one. Just go out there and walk once. I'm on a listserv with some folks, and somebody said something about, I just started working out, and I said, look, they quit working out. They'd been working out regularly, had an injury, quit. How do I get back? I said, 5 minutes. Go do 5 minutes. That's all you got to do.
Yeah.
And what'll happen, at minute 4, you're saying, I think I can do a little more than 5 minutes. But even if you don't, that's fine. Just do the 5 minutes. But you got to it's the micro goals, Craig, just like you said. It's just, I don't have to win a marathon. All I got to do is go out and walk a block or a half a block or whatever I can do, go do that. And then, because it's really not about, to me, the secret sauce to all this is making it part of your lifestyle, not something you add on. Oh God, I got to go work out today, or I got to go exercise.
It's what I do. It's my release.
Exactly. It's what I do for my physical and mental health. And it's really for both.
Awesome. Craig, what do you think? Summarize. You got any thoughts or questions wrapping up?
I can't say much more than that. I mean, get off the couch, do it with a buddy if you can.
I think it just becomes enjoyable, when you make it something, particularly if it's hacky sack, for crying out loud. If you enjoy kicking a hacky sack ball, it's just fun. It's an active way of life like our bodies are designed to do. Exercise is so key. Denny, I really appreciate you coming on the show too. It's been super fun too, on a topic that I just wouldn't have known where to go with and how to go about it. So this has been super awesome.
Well, great. You guys have been great hosts. I appreciate you having me.
Appreciate you coming. Thank you.
Craig, why don't you kind of maybe snap us in gear, take us out of here, and I'll tell you. See how I did that? That just rolled off, didn't it?
What's
snap
that?
us into gear and take us out of here, man.
Yeah, man.
And I'll tell you where we're going next.
You can find out about more about me and Chris and the show at throughwiththerapisteyes.com. We have blogs for each individual show. You can stream right from there, or we're just on about any podcast platform. You can also find links to our social media on our website. Sign up for our email list. And if you're enjoying the show, tell your friends, man. Word of mouth is the best way to advertise. And if you're enjoying us, we'd appreciate that. Also, leave us a 5-star review and subscribe if you haven't done so already.
Is a 4-star review okay?
4 stars okay.
3-star?
Some people say nobody's perfect, which we're definitely not.
Hey, put some comments out on YouTube when you're watching. Put some comments in any fields that you got. That really helps out the show a lot. I have learned, because we've gotten some comments, and I see them kind of flood back to me in different list services that we do in monitoring stuff. So that all stuff really does make an impact on what we're trying to grow here. How about we go to you next, Craig?
Me?
Yeah.
What do you mean?
Your thoughts and some stories that you have.
Yeah,
that leads to some really.
Yeah, well, we might talk about that. We might not.
Oh,
we'll see.
Oh, okay.
Stay tuned.
We may have a change of plans, because in combination with that, we have some information about school shooters and an article that was, I think, really dynamically interesting. And it was the largest governmental study that demonstrated actually like 4 specific characteristics that seem to span all of the events. Like I said, all of the events of 100 different characteristics that they were marking and watching for. I was really struck by this. It was interesting, if not a complete study, but an interesting conversation about it, in the minimum.
Cool.
All right.
Looking
we'll see you guys
for sure.
See you guys all next week then. Thanks again, Dr. Morrison.